Welcome to Beyond the Data. I'm Dr. Phoebe Thorpe, and here with me today is Dr. Ron Rosenberg from the Division of Vector-Borne Diseases, and the Associate Director for Science there. Thank you very much for joining us.
Thanks.
I have to tell you, Ron, if in the 60s, a science fiction author wrote a story about a disease that was transmitted by mosquitoes that could, if a woman got it while they were pregnant, cause severe birth defects in their baby, and that half the people wouldn't know whether they had the disease or not, nobody would believe that story. But here we are with Zika. So Zika is a vector-borne disease, meaning it has three parts. There's the mosquito, the disease, and the people who are infected. Let's talk about all three of those. Let's start with how can people protect themselves and prevent getting infected?
Well, of course, the most important thing is simply not to get bitten by the mosquito. In the case of Zika virus, we do not have any transmission in the United States, in the continental United States. We do have transmission in Puerto Rico, American Samoa, and we have transmission now in South America and throughout Central America. So one way one can protect oneself is by taking that into consideration when you travel, especially for pregnant women. When you do travel, if you must travel to those places, take the precautions of trying not to get bitten by mosquitoes, using insect repellent, long sleeves, trying to stay in air conditioning rather than being outside a lot.
And the other part about staying in the air conditioning is staying in places where there are screens so the mosquitoes don't get indoors.
That's correct, yeah.
So what you've described is areas where there's local transmission, meaning the mosquitoes are able to transmit it from one person to another. What about when the travelers return to United States? They also need to do that same precautions about avoiding being bitten by a mosquito, because they might not know that they got Zika while they were traveling to a place where it is being transmitted. And it's for 3 weeks that they have to continue those precautions.
Well, that would be kind of a general guidance that we'd want to give. You're quite right that the majority of people who are infected with Zika probably will have no symptoms or very mild symptoms. We don't yet know how infective those people are to the mosquitoes. So it would be a good idea if you come back from an area that has transmission of Zika going on, if you would continue to protect yourself from getting bitten by mosquitoes.
The other thing that's very unique about Zika is that it's also sexually transmitted. And so the recommendations are that if a traveler, especially if a male travels to an area where there's local transmission, that when they come back, they protect their partner.
That's true. And of course, this would really be, especially for men with partners who are trying to get pregnant or who are pregnant.
Okay. And they should be preventing, either abstaining or using condoms to prevent?
That's correct,
okay.
Yes. A condom would be a way of practicing safe sex and preventing the virus from being transmitted.
So let's shift to the mosquito. Tell me something about the Aedes aegypti mosquito. What do we need to know?
Well, the mosquito is very similar to mice and cockroaches and houseflies in that it has evolved over eons to live with humans. So it lives in and around houses, and it tends to lay its eggs in little bits of water, can be as small as a bottle cap, that are littered around houses, flower pots, dog's water bowl, and almost anything that you can imagine.
So as you're talking, I'm thinking, oh my gosh, I like to grow plants, and I have a lot of the roots in flower pots inside my house. So if I had a mosquito, an Aedes mosquito in my house, is there something I need to do with that water? Or I know there's been some recommendations about dumping things out. What are those guidelines?
Yeah, I certainly would recommend that you don't keep any unprotected standing water in your house, especially in areas where we know Aedes aegypti breeds, because it can breed in that water. The easiest thing is just to dump the water out once a week, or even more more often, or put a cover of some kind over it to prevent the mosquito from going in.
So, and then what about stuff for outside the house? There are similar recommendations. What else can people do?
Well, again, it's very useful to not have standing water around the house, especially in containers. If you remove those, then the mosquito has no place to breed. It's probably not that useful for individuals to spray around their houses, but it might be useful if there are a lot of mosquitoes to use an insecticide inside the house. Inside the house, okay. And then I know there are recommendations about which specific insecticides to go to. Is there a website for that? Well, the CDC website, the Zika website for CDC will have a wealth of information on how you can protect yourself and what you can do about protecting your house and your property.
Okay, and your family too.
And your family,
yeah.
Of course.
And so we've talked about the mosquitoes and we've talked about the people who are infected. What about the virus itself? Everybody wants to know, is there a vaccine? There is no vaccine.
And that's what makes the protection from mosquito bites so paramountly important.
Do we foresee one coming?
I know that there are many people working on a vaccine, and so I certainly hope that we will have a vaccine. But as you know, vaccine development is not easy. It takes a long time, and I don't foresee our having a vaccine anytime, certainly not for this summer and probably not for next summer either.
And there's no treatment either for the disease once you're infected.
That's correct. It's a typical viral disease, and we don't really have a therapy for it. With the exception of the birth defects, which is far and away the most important aspect of Zika transmission, it's quite a mild disease. About 80% of the people who are infected with Zika virus actually have no symptoms at all.
That's 80% is a lot.
Yes, it is, but they're infected.
Yeah, and infectious if they were bitten by a mosquito.
Probably, although that has not been demonstrated completely yet, but we are conservatively expecting that they will in fact be infectious.
And so that means that the 20% also get symptoms. What symptoms do they get when they get Zika?
The symptoms are really quite general, and they're the same symptoms that you would have for a lot of viral diseases. So there's headache, fever, myalgia, general muscular pain, sometimes joint pain. There's one thing, however, which is conjunctivitis, which is not terribly common with other viruses of this type. But in general, it's pretty hard to just diagnose from the symptoms that someone has Zika.
Yeah, and that's part of the difficulty with it also, is that if you had those very general symptoms, you might not know that you had Zika, or it could look like it's something else.
That's correct.
Yeah. Where else would people go if they wanted to find out more about Zika and what to do to protect themselves, or about the disease, or about the mosquitoes?
Well, CDC has an excellent website, if I can say that. And if one goes to Zika and CDC, it's easy to find the website. There's a huge amount of information on there about the disease, about preventing the disease, about the mosquito vector, and how to keep it from biting.
Okay. Thank you very much for joining us.
It was my pleasure.
And thank you for joining us for Beyond the Data. See you next time.